Hi, good afternoon. It's great to be here. My name's Jennifer Payne, and I'm going to be talking to you today about coaching with acceptance and commitment therapy. So I'm happy to be sharing this with you today. So just a little bit about me, first of all. I'm presently a research scientist and a clinician at the Kennedy Krieger Institute in the Center for Child and Family Traumatic Stress. And then I'm also an assistant professor in the Johns Hopkins University Department of Psychiatry. And what I do there is I am in the process of coordinating an acceptance and commitment therapy clinical service within the adult segment of Kennedy Krieger. And spiritually, I'm an ordained evangelist with the Pentecostal Assemblies of the World. And my mission statement for my life is the scripture that you see here, Jude 1, 22 and 23, which is, and of some have compassion, making a difference, and others save with fear, pulling them out of the fire, hating even the garment spotted by the flesh. So for the objectives today, our training has primarily two objectives. First, I'll introduce you to ACT by looking at the goals, the processes, and the uses of ACT. And then we will focus on ACT for coaches by watching an example of ACT coaching. But first, I need to give a special thank you to the Association for Contextual Behavioral Science in general, and to ACT pioneer Stephen Hayes, Dr. Stephen Hayes, and Dr. Sonia Batten. So in the ACBS organization, you can find lots of resources, scripts, protocols, PowerPoints, and all of this is because they have the attitude that the information should be open source. It should be available to all ACBS members. So much of this presentation came from the work of others, like these mentioned. So first, let's talk about where ACT comes from. The first wave of therapy, and there's three waves of therapy, but the first wave of therapies pretty much were characterized by behavioralism. So if you remember in your psychology classes, operant conditioning or classical conditioning, like Skinner and Pavlov, then you would understand that those were the first wave of biological therapies, or behavioral therapies rather. When you look at the second wave of behavioral therapies, then you can look at Albert Ellis, Aaron Beck. They were some of the pioneers of the second wave of behavioral therapies. So cognitive behavioral therapy, or CBT, is a second wave treatment. And what it does is it integrates a person's thoughts and beliefs in understanding and changing behavior and emotional experiences such as depression. And so then a third wave of therapies, behavioral therapies, came about. And ACT is a third wave therapy. And so third wave cognitive behavioral therapies are a group of emerging approaches to psychotherapy. And third wave therapies prioritize the holistic promotion of psychological and behavioral processes associated with health and well-being, instead of just focusing primarily on emotional symptoms. So again, the third wave is more holistic. And so in the third wave interventions, concepts such as metacognition, acceptance, mindfulness, personal values, and spirituality are frequently incorporated into those third wave behavioral interventions. And some examples of some third wave interventions include dialectical behavioral therapy, or DBT, functional analytic psychotherapy, or FAP, mindfulness-based cognitive therapy, mindfulness-based stress reduction, compassion-focused therapy, and ACT. ACT is a third wave cognitive behavioral therapy. So what is acceptance and commitment therapy, or ACT? So Stephen Hayes, the primary founder of ACT, defined it as such, and this is a quote directly from him. It's a psychological intervention based on modern behavioral psychology, including relational frame theory, that applies mindfulness and acceptance processes and commitment and behavior change processes to the creation of psychological flexibility. And so we're going to break that down so that you'll be able to understand it a little bit better. So one thing that I did mention is that ACT is a comprehensive model of therapy. It's not just a set of techniques. So it's not just like some tools or tricks or techniques, but instead it's a fully formed, comprehensive model of therapy. And another thing is that ACT has a conceptual framework that it comes from. So what that means is that ACT is based upon another theory about language. And that theory about language is called relational frame theory. And I'm not going to go into detail about relational frame theory here, except to say that one thing about relational frame theory is that all humans have the ability to relate or to associate things through language. For example, a baby can learn that the stove is hot without ever touching the stove, his or herself. And so most babies learn that the stove is hot through language, not experience. There are various ways that the mind can make connections through language. And really, we relational frame theory is basically saying that this is a normal process of the human brain. This is something that we do on a regular basis. We make these connections and we make these relations with things. And so connections, they can automatically be made, whether we have good experiences or bad experiences. So as another example, if Jane had a trauma at age 16 where she was unfortunately sexually abused by a tall boy that she had gone on a date with, then Jane could, without even trying, make a connection, make a mind connection that other tall boys are dangerous. And she could just make that connection without even really thinking about it. That thought might be generated automatically. And it might lead Jane to avoid all tall men, even non-dangerous ones. And so relational frame theory is about these associations that we make through language. And ACT works to look at these associations that we make and to examine them. So as Christians, all of us are aware that God is with us in life through highs, through lows, through ups, through downs, through mountains, through valleys. And we know that being a Christian definitely does not mean that we will not ever experience pain or suffering. So it doesn't preclude us from having suffering or having pain just because we're Christian. But one positive thing about ACT is that it highlights the ubiquity of suffering. And what ubiquity is the state or capacity of being everywhere, especially at the same time. So suffering in ACT is seen that way. Suffering is seen as present for every human. So the reason why that's a positive thing is that suffering is not seen as an outlier. It's not seen as like a disorder. In fact, suffering is just a normal part of life. And so there's actually something soothing and normalizing in realizing that pain is just a normal part of life for all humans. What ACT wants, the goal of ACT, as we talk about the goal of ACT, the goal of ACT is to help us as humans to move forward in our values, even in the midst of pain, even when we're in a uncomfortable space. Can we move forward in our values? And so we do want to live a full and abundant life, just like Jesus mentions in John 10:10, that we might have life and that we might have it more abundantly. And so a person who can live this meaningful life while accepting pain is a psychologically flexible person. And so we're going to talk more about psychological flexibility later. But the main focus of ACT is on the function and the context of thoughts, feelings, and behavior. What that means is that ACT doesn't focus on the content of our thoughts themselves, but instead ACT focuses on how that thought affects our life. So in other words, they don't care necessarily about the thought itself. So like say if I had a thought, I am a failure. We're not examining that thought itself, I am a failure. But what we are examining is, how does that thought, I am a failure, hinder you? And if so, how? How does that thought, I am a failure, work to move you toward your life values? And if so, how? And that's what ACT focuses on. And so basically, said really simply, the whole goal of ACT is to get us to show up, to let go, and to get moving toward our values. And so ACT is a good model to use when coaching, because it's not like other therapies. So some other therapies or many other therapies need a person to be diagnosed in order to help them. But instead, ACT assumes that all humans sometimes get stuck. So we're not broken, we're not sick, we're not mentally damaged when we get stuck. In fact, the processes that get us stuck are normal processes. They're just language processes. They're based on the way that we learn language. So the coach is not an expert up here while the client is down here. It's just two humans in the room working together. And so this is the primary ACT question that goes through sessions. So basically the question is, giving a distinction between you and the stuff that you're struggling to change, are you willing to have that stuff? Are you willing to hold that stuff fully and without defense, the way it is, not as what it says it is, just not trying to change it? Are you willing to have that stuff? And are you willing to do what it takes for you to move in the direction of your chosen values at this time in this situation, even with the stuff? And so in order to get to these, to help people with ACT, there are 6 core processes. These are called 6 core therapeutic processes of ACT that we're going to go over. Diffusion, acceptance, contacting the present moment, Selfless Context, values, and committed action. And so these are the 6 core processes of ACT that we're going to be discussing today. And when you look at all of these 6 core processes, as you can see, these 6 processes form a 6-point model, and it's called a hexaflex. So hexa means 6. So if you hear the term hexaflex, then it's referring to this 6-point model that ACT uses in order to help people. But before we get into the details of the hexaflex, let me just stop for a minute and talk a little bit more about the types of issues that ACT works well on. And so when you think about being stuck, what comes to your mind? I know that most people who are stuck and most people who are not moving toward their values are engaged in other behaviors that will help to distract them from what they want to do. For instance, say John desires to become a dentist. Say that his parents were dentists and he wants to become a dentist. He's in school to become a dentist, but he has a thought: I am not smart enough to be a dentist, or I'm going to fail at being a dentist. So because he has those thoughts, what he ends up doing is he engages in a lot of avoidance. So he engages in avoidance behaviors so that he won't hear those thoughts, or he won't feel the pain of those thoughts or the anxiety that those thoughts produce. And so during his dental classes, he might procrastinate from studying. He might spend a lot of time worrying about his classes. He might even take a drink before his exams because of his anxiety. And so these are some methods of avoidance that humans engage in. But as you see on this slide, there's other methods, there's many other methods of avoidance that we as humans engage in. And that's what experiential avoidance is. The whole point of the avoidance is to try to avoid whatever it is that thought or that belief that is causing discomfort. And so does it resonate with you that the more importance that we place on trying to avoid anxiety, the more we develop anxiety about our anxiety? So when you think about John, and the more that he tried to avoid his anxiety about his dentistry path, the more he developed extra anxiety about the anxiety that he had. And that's the way the mind works at times. And so we begin to understand that emotional control strategies like these avoidance strategies, they work in the short term, but they do not work in the long term. And you may be able to think of some many other avoidance strategies that you yourself may use. Me being honest and me being transparent, there's times when I find myself on Facebook or on a social media site when I'm supposed to be doing something that is uncomfortable for me. So for instance, maybe I may need to be doing like something like even preparing this talk, maybe. Let's just put that as an example. Preparing this talk, but instead finding myself on Facebook for a minute. Like, how did I get here? How did I get here on Facebook? Those are methods of experiential avoidance. And so there's a lot of research that shows like the more avoidance that you have in your life, the more experiential avoidance, the more anxiety you may have, the more depression. So higher experiential avoidance is correlated with poor work performance, with difficulty of learning. It's correlated even with substance use or abuse, or eating disorders, or lower quality of life, or higher risk of sexual behavior. And so, all of this experiential avoidance is associated with, higher risks of being stuck in a variety of ways. Higher experiential avoidance equals psychological inflexibility. So like I mentioned to you in the beginning about being flexible, being able to kind of roll with the fact that, yes, we have pain and suffering, but even in the midst of pain and suffering, I'm moving towards my values. That's psychological flexibility. The opposite of that is psychological inflexibility. But again, the goal of ACT is to increase psychological flexibility in individuals. So these 6 parts of the Hexaflex come together to help a person flexibly move toward their values in the midst of pain. And so we're going to go over each of these 6 core portions of the Hexaflex in the next slides. And I'll have to just like put this out here that this information is just a very, very brief introduction to these concepts. It takes people a number of times to go over these concepts in a variety of different ways in order for you to really like absorb them completely. So please don't feel like, oh wow, I don't understand all of this completely right now, because yeah, it takes quite a bit of of learning and relearning of these concepts in order to really grasp them. Okay, so let's talk about acceptance first. So when you think of the word acceptance, what comes to your mind? Now, some people, they think of that word negatively. So they might think of it, oh, now acceptance means you're asking me to submit to my pain. You're asking me to yield to my pain. Oh, you just want me to tolerate my pain or put up with it. But that's not what acceptance means in ACT. In ACT, acceptance is not just tolerating something or putting up with it. It's not just resigning oneself to pain passively. Acceptance is not defeat. Acceptance is not a less than alternative. But instead, acceptance is actually being willing to stay in the present moment, even if the present moment is painful. It's acceptance, the whole purpose of it is to not try to squirm away from the pain or to distract from it. Acceptance is just what is said here. It's an active embrace of the present moment, fully and without defense. And with whatever comes with that present moment. Some present moments feel good, some present moments are not as great. But the willingness to sit with the anxiety or the fear or other pain that we feel, it's actually a purposeful willingness, because it's a willingness to stay in it, because doing so will move us towards what really matters to us. And and basically it's just accepting our emotions, accepting them, not degrading ourselves that we're having emotions, not downgrading ourselves to say, oh, I'm not being spiritual enough. That there was a study that I did, that and a publication that I published in a while back, and the title of it was "Saints Don't Cry," because often in some Christian circles, having emotions is not looked at as positively. However, we have to get to a place where we allow our emotional responses just to happen, to not put a label on them or a judgment on them. Just allow them to happen how they happen. Don't try to deny them. Don't try to make them different from what they are. And really, this is teaching us a skill that, yes, we can feel this emotion. We don't have to change the emotion. We can still move towards what matters to us. Okay, let's talk about cognitive diffusion and cognitive fusion. So as you can see right here, this is a little picture of what cognitive fusion or diffusion looks like. Cognitive diffusion might be somebody thinking, I'm a loser. Cognitive fusion, cognitive fusion would be, I'm a loser. Cognitive diffusion might be, there I go again, having the thought that I'm a loser. So let's get a little bit deeper into this. So cognitive fusion is just a fancy way to describe the way that we get caught up in our thoughts at times. So we all go through these trials and tribulations at times, we know that. Sometimes, however, we can kind of begin to live our lives as if we're being defined by our trauma, defined by our hardships, or defined by our disabilities. So for instance, people can say after sexual abuse or after some other like trauma, for example, I am damaged goods. It's often an I am statement. I am damaged goods. Or people might go through situations in their lives and say to themselves, I am not good enough. And so this is how the events in our lives and our thoughts and interpretations of those events can end up merging or blurring into one. And this is really what cognitive fusion is. Cognitive fusion is not a good thing. Cognitive fusion is, again, what we do at times when we begin to merge some of the experiences that we've had in our life and begin to start defining ourselves by those experiences. But diffusion, on the other hand, is a good thing. So cognitive diffusion, to stop being fused. So in those cases, what we're doing is we're noticing thoughts as thoughts. Knowing that you know what, I am damaged goods. That's not true. That's just a thought. We're not trying to change the thought. We're not trying to change the form of it or the frequency of the thought. We're not trying to run away from the thought, but we understand that they're just words. They don't define who we are. And so these are just some very brief, simple techniques when it comes to cognitive diffusion that some ACT coaches use. So, you might hear an ACT coach say, well, yeah, just notice right now what your mind is telling you. Is this a helpful thought for you? Is this a good use of your time? Notice the form of the thought that you have by describing it. So if you could describe I am damaged goods in a picture, what would it look like? What would it sound like? Or workability. How is that thought working for you? Tell me about that. And so there's a number of different ways that that ACT coaches and ACT counselors, how they help people to kind of take a look at thoughts for them to just begin to see that they are just thoughts. They're not reality. Okay, so Selfless Context, we'll talk about this briefly. And again, remember, I'm kind of breezing through these. So Selfless Context. So what that means is a lot of times that our perception of who we are as a person is often skewed, or is often kind of miscalculated, or it's a little bit like tainted as a result of the stories that we tell ourselves. So these are some old tapes that play for our lives. And I'm sure for those who are younger, I could say old DVDs, but for those of us who are a little bit older, we know what cassette tapes are. Old tapes that play in your head, like, oh, I'm stupid, I'm incapable, I'm ugly, those old tapes that go on, or defining again self by events or traumas that occurred in life. Through the self as context work, we can learn that we are bigger than the experiences that we have gone through. We are more than the experiences that we've gone through. We extend beyond those experiences. And so through learning self as context work, which again, it would be impossible to teach that in this short training, but through learning Selfless Context work, we can help a client to be able to understand that they're bigger than the things that they've experienced. Present moment awareness. So present moment awareness is a little more straightforward than some of the other concepts we've talked about, but it's just, being straight up in the present moment. So being able to accept what's going on in your environment right now without trying to change it. And so there's a lot of mindfulness skills that are taught through acceptance and commitment therapy. And because the goal is to be able to pay attention on purpose in the present moment, what's going on right now, and not be judgmental about it. And so really, like, there's a lot of clients that don't live in the present moment. Some live in their past more than or they try to live in their past more than their present moment. In that maybe they're, stuck, or they, think about, back in the day when I was in high school, this happened or that happened. There's others that are really like continually anxious and thinking about the future or an imagined future. And they're not really present in their present. But one thing about ACT is that, again, it teaches you to be in the present moment. And it's important to be in the present moment so that you can, again, focus on your values and move. And so then we come to values. Values is another part of the Hexaflex. And so values really have to do with, just understanding your chosen life direction, identifying your chosen life direction. And that's what the coach can help a person with. These are not goals, because goals are, things that we do often. There's people that have created goals or resolutions, for New Year's. Goals are different, but values, these are values don't change. Well, what I mean by that is values are things that that you don't achieve necessarily, but they're things that you're always moving towards. So for instance, spirituality might be a goal, or kindness might be a goal, or authenticity might be a goal. So what I'm saying, all of these might be values, not goals. So those are all values, those three things that I just mentioned. And so, your values are not what somebody else says they should be. Your values are not something that, because of my religion, I should have this or I should have that. Your values are what you really hold dear. What are the things that are vitally important to you? What are the things that, light a fire in you? Like, for instance, a value might be family, or a value might be, community. But what are those things that just light a fire in you? Those are your values. And then committed action is the walk towards that value direction. So moving towards whatever your values are, even in the midst of self-doubt, even in the midst of anxiety, even in the midst of uncertainty. And there's a willingness in committed action. So as you see, there's a basketball here, someone who's playing basketball, shooting hoops, continually shooting hoops. They may not be that great, but that's not the point. The point is, are you willing to continue? Are you willing to experience difficult events and still move forward anyway? Are you willing to risk failure at times and still move forward? Are you willing to have, whatever it is, a leap of faith or trust, or whatever it is that you think of, in order to move forward, to try, at least to try. And that's what committed action is about. And so again, when you look at all of these, 6 pieces of the Hexaflex, they all come together, and they're all used together for ACT coaches use all of these in different ways in order to promote psychological flexibility, which with the goal of first, of allowing people to let go, to show up, and to get moving. Okay, so for the last piece of this this training, I'm going to allow you to watch an example of ACT coaching. And this particular coaching demo happened on January 12th. And actually, I was the client. And when I put client in quotes, because, it wasn't a paid thing, but, and then the coach is Eric Larson. He's an experienced ACT coach. So as you look at this, hopefully you can see how some of the ways that he used some of the different 6 parts of the Hexaflex.
So yeah, I mean, I just like to say out loud, of course, that we're in this slightly contrived environment with other people and colleagues, and that reminder again that I'm really grateful just to have you step forward and receive whatever there is for you to receive today. So thank you.
Thank you for your service.
Yeah. So I'm noticing a little dryness in the throat and in the mouth, and my heartbeat is talking to me. So just calling those things out as we begin, and also real eagerness, like to get to know you, this person who's stepped forward and who I've not met before. So wondering if you're making any observations as we settle in.
I am eager to get some kind of coaching for what I'm going to talk about. I am a little less nervous now that I can't see everybody, so that's good.
Nice. Cool. So is there anything that would kind of support you in just arriving and settling in before we begin that you would typically do, or that I can help facilitate, just so that we're giving ourselves enough space and comfort to be together?
Well, thank you for asking. I think I'm pretty, like calm and centered for now. I mean, I guess maybe if I wasn't, I would maybe do like a short meditation exercise or something. But I feel like I'm in a pretty good space right now.
All right. Well, let's see what unfolds. So what you alluded to, sort of having something in mind for the time that we have today. Can you tell me a little bit about what came to the foreground for you?
Well, sure. So actually, I took some not classes, but I started the process to be a coach myself. It was like, so I took classes within the International Coaching Federation. And I gathered some of the hours that you need in order to sit for the test. But I have been very resistant to taking the test. I'm not sure why. And I would like to eventually have like a part-time coaching business where I'm doing coaching for clergy and, a little bit of spiritual coaching as well as like some vision coaching and things like that. But for some reason, I have delayed this process. I procrastinated on it, and I have it on my goal sheet for 2022. But when I look at it, I don't know. It's just like it's not moving forward. Let's put it that way.
Yeah. Got it. So there's this aspiration. You started this process. Sort of, at least in theory, you'd certainly like to do this. You have some ideas about what it might look like when it is out there in the world. And here you are at this spot. And when you arrive at this, whatever there might be next to do, something there, you kind of camp out there, or is something doesn't happen.
Yeah.
I'm curious about that moment. So you've done all this stuff. You've clearly thought about it a lot. It sounds like it matters to you, that you can serve people in different ways. What happens when you arrive at that moment? And you said, kind of, I don't know. So I'm curious if we can kind of, even just slow down and be in that, at that moment when you kind of might start to think about doing it, and like what is it that occurs in that moment?
Yeah. I don't know. I guess I don't know if it's interesting because I don't know if it's fear involved in it. I'm not sure, but I actually had lots of opportunities thrust on me in a positive way. So what ended up happening was, it was about three years ago, or I think it was before the COVID started. So like probably like 2019 and in the early part of 2020, where I got approached at the university that I used to be at, and they asked me if I wanted to be a coach because they were gonna start a program for pastors and clergy there, and they asked me if I wanted to like be trained in it. So they paid for the training. So I went through the whole thing, and they paid for the training. And I am really interested in it. It's just, I guess I'm not exactly sure why I, at this point, am feel a little stalled with moving forward in it. I know that, so I know, and now let me back up. I'm a therapist. I've been a therapist for many, many years. I know how to do therapy, right? I don't want to do therapy for a private practice. So I don't want to do therapy, but I would like to do the coaching for like a part-time private practice. I would like to do that. I can see myself doing the coaching and consulting, not so much the counseling piece. But again, even though I see the vision of it, when it comes to like me doing the steps that I need to do in order to get there, I feel stalled. And one more thing about myself is that usually when I set a goal, I absolutely do it. Like it's like I'm not usually like somebody gets stalled. So that's where I am.
Yeah. So you use kind of at first talking about this experience as kind of calling it kind of resistance and sort of feeling sort of stalled out. So kind of a weird question, like apart from the things that you think ought to happen don't happen, like how do you experience resistance or being stalled? Is it I could imagine, from some of my experience, I start to worry, or sometimes I just kind of go blank and I end up on Facebook, or like, I'm curious about what that experience is for you when you do start to think about it. You know, and you mentioned this organization paid for it. So I'm curious about what that looks like if I were there with you and you turned to me and you said, this is what's happening as I start to think about moving forward with this. What is it that you might be telling me?
Yeah, I mean, like, so a lot of outward behaviors would be like getting distracted or doing something else. Like, I mean, it could be Facebook, you know, it could like could be getting stuck in those like little TikTok videos they're on Facebook.
I know, those are pesky, those things. I tell you.
Yeah, it could be, I mean, it could be me focusing on other things, you know, that are on my plate. You know, because, you know, I do, like, as far as my job, I have like some academic things that I have to do. So it could, like, it looks like when I see the emails about the different things that have to do with these tasks,
Yeah.
not seeing them, but not seeing them, like, kind of not necessarily avoiding them, but I see the emails, but I don't act on them, or I see the emails and I don't see them, and then I forget that they're there, and then 2 weeks later, you know,
It's still there.
Yeah, yeah, it's kind of buried right then. But
Yeah.
so, like, right now, what my next step is like, I took all the classes, but then they changed the ICF test, like, in between the time when I took the classes. So I need to, like, take another, just another module. I don't know how long it is. I don't know if it's like 3 hours or 4 hours, but I need to take another module and then, you know, start studying for the test, and then set up the test, start studying for it. But I bought the module right away, but the module's somewhere. Like, it's sitting somewhere in my email somewhere. I mean, I bought it immediately, but then after that, it was like,
Yeah. And I noticed, like, just some like kind of quick movements, and kind of like, I wonder, like, what is that even right now, as that's sort of that kind of energy, if you can speak to that at all, because it seems like, yeah, it's kind of here even as you're talking.
well, you know, like the I shoulds, like, you want to slap yourself a little bit, you know, get to work, do what you're supposed to do.
Okay, so so as you're naming this, going, oh, there's that module, it's sort of a next step, and then you're thinking, oh, you don't do it, then here comes the should.
Yeah.
One of the voices.
Yeah.
And when that gets chattering, how do you respond? Like, if we were to make this a slow motion movie, here comes the should monster, and it's going to do its thing with you, right? It's going to, you know, act how it acts towards you. What does it feel like when that starts to happen?
It feels uncomfortable. So, I mean, I guess I try to shut down should, and then I end up shutting down everything.
Right, that makes so much sense. Like, well done. I mean, I get it, right? Like, there's something that's really important to you here, but also, I mean, what you just said is quite insightful to me. You're really solving a problem of the moment, right? I don't want to feel that discomfort, whatever the nature of that is for you, and we can talk a bit more about it, but I'm guessing it's pretty familiar to you.
Yeah.
So you have that, then the discomfort follows, and all of a sudden you're on TikTok. I go, problem solved. You're a genius. It's good. I appreciate it. So I'm wondering if it would be safe to do so, and if you know, and you have your hand on the volume, so we can kind of go into it as much as you want, and come right back out. If we could look a little bit at the nature of that discomfort, not the reason for it. That's not so much what I'm interested in, is like, I mean, I saw it impact you physically. So I'm curious if we just sort of consulted with that version of Jennifer who has to go through that discomfort.
Yeah.
What is
Okay.
it that she's experiencing, and see if we can give some language to or notice what that discomfort is that then happens, that it becomes a should, or
Right.
that's in response to the should and then becomes this behavior. What is that experience? Like, if I were an alien, I've never been in a human body, and you're telling me about this thing called discomfort, and I say, does not compute. What is it that you're going to educate me about?
Yeah, I mean, it feels like, I mean, I don't, it feels like something like anxiety. It feels something like, oh, you're not doing what you need to be doing, that type of thing. Oh, you know, you're not following through on what you need to follow through on.
Yeah. So another twist on the should thing, like there's something accusing you of, you should be doing this and you're not following through, and then there's a anxiety, you call it, kind of in response to that.
Right.
Yeah. And if we were to like, yeah, please.
Oh, I was going to say there's another piece to it, because so there is a piece in regards to, and I think this is a big piece, but there's a piece in regards to, you might not have been able to handle like all of these balls or juggle all these balls anyway, like, because, and the reason why that comes up is because like I have a medical condition that has slowed me down over time. And so I used to be like the multitasker, like being able to like juggle 100 balls at once.
Yeah.
And now I'm not. I don't feel like I'm as able to do that. And so that always that comes up too, that oh, okay, you probably wouldn't have been able to do that, you know, anyway, that type of thing.
Yeah. And then, so in the kind of accusatory should voice is a little bit of anxiety, and I appreciate your naming this, and it's nice to get that as context. So if that's coming in and sort of saying to you, you might not be able to do this, or whatever it is, and how do you notice yourself responding to that possibility or that voice? Like, what's the feeling there?
That's when the attempt to shut it down comes. So it's like, I want to shut this voice down. I want to shut, you know, this whole conversation down. So let's go on like TikTok, or let's watch some cartoons. Let's do something else. You know, let's not talk about this right now. Maybe, you know, maybe it'll come back up, you know.
Later's always I found it to be a great time. Yeah. So I notice, and this is similar to what you talked about with the should, there's this, and this is how it goes, I think, for us, is like that it's helpful, right, to slow it down. There's that experience of that voice, whether it's a should, or you might not be able to do this, and then you notice the next thing you notice sort of is that behavior, or the shutting it down.
Yeah.
So I'm wondering if you'd be willing, and again, it's your choice, and you get to have your hand on the volume. There's kind of this blank between when the voice shows up to say those things to you and the behavior, and it sounds like it's discomfort, right? That's what we name it generally. And then anxiety is the name you gave it before. It seems a little bit activated. What we know about it is that you don't want to really feel that, because otherwise why would we shut something down, which I really appreciate, because it's an act of care for yourself. But I'm wondering if we just like dipped this much of our fingernail into that feeling, if that would be okay, if we could learn something about that feeling when you're accused by the mind of maybe you can't do this. What's that?
Yeah,
That
yeah.
arises.
Let's do it. Let's do it.
Okay. So maybe let's, yeah, if it's okay, let's go inward a little bit. So you can cast your eyes down, or if it's safe to close your eyes, that's fine. And you can just check for safety. And, for the moment, just kind of just let the dust settle, right? In the way that we do as helping people. We can take a few breaths, or, just move the body a little bit. You're not going to be asked to do anything here that will physically make you unsafe, but you might know that there might be an uncomfortable feeling or two, and just, permit that for a moment. And you can help yourself sometimes by just noticing the way in which you're connected and actually present, right? So the feet might be on the floor, and you can test that out by pressing them into the floor and receiving feedback. And just a really nice way to support the mind in understanding, I'm here, I'm in a body, I'm in a place, this is okay. And then notice too where the body makes contact with the chair. The same thing, gravity is pulling you down, the chair is holding you up, and that's very real and concrete here in this moment. So we can bring our attention just to that place. In some ways, we can use our mind as kind of a movie screen for a moment. And all we want to do is just roll this little bit of tape. And this is the part of the movie where Jennifer opens maybe an email, or she starts to see something related to the coaching training. And she sees that, and then the voice could be the should voice, or it could be this voice that says, you've had this condition, you used to juggle, you might not be able to do it anymore. And we want to watch Jennifer on the screen. And we have special access to Jennifer on the screen. We can see a little bit about what happens in her mind and her body before behavior starts to show up. I just want you to take your time. You can play this movie, a little clip, as slowly as you want, but just kind of be there observing Jennifer as she experiences this, and see if there's anything to be learned about what it is that happens in her, what emotions show up when that voice says, you might not be able to do this. And just see if you can get a little feel for it. And if you do, if you can give a little language to it without kind of fully coming back to me, that can be helpful. And if you can't, that's okay. You can just wait, see if anything happens.
Yeah, it feels like a deer in headlights.
A deer in headlights. Okay, really nice. And where in the body do you sort of notice that feeling that we know as deer in headlights? Is it up in the head, the neck, the chest, the belly? How does it show up in this moment?
Most, not every single place, but most like places, like definitely like arms, legs, eyes, like frozen kind of thing.
Yeah, like frozen. So there's Jennifer, and there's a little bit of a frozen sort of feeling. So I wonder, as you sort of watch her and see, oh, she's frozen. And you and I know, as we talk here, that you're safe just there by your printer and the things behind you. I wonder what might she need just now as she's experiencing that frozen, that might really be supportive, and whatever comes to mind. You don't have to figure that out, but what what's your impulse as you see her? It's hard to be frozen.
What did she need? Kristen?
Yeah, or what are you moved to do? There she is. She's really suffering in that moment. I mean, it might be quite scared, or frozen. So I'm curious what, as you see her there and frozen, what, do you have any impulse to support her? What might that be?
Guess for her to get out from the headlights. I don't know. I'm not sure, but yeah, I'm not sure.
Yeah. Well, okay. And if that were, you would like to support her and if there were headlights to not be in those headlights. So a couple of possibilities, and Jennifer, you and I can collaborate on this. There isn't a right way to do this, but I wonder if we could bring some movement to your body, and that could just be moving your head, maybe side to side, and just to see if you are indeed frozen, right? And just exactly, and you could include, if the head can move, maybe the shoulders, right? And I'll do this with you. And we can really see, okay, it's not so frozen in this moment. We're not trying to prove anyone wrong. We just want to really be here in this moment, what's true. And if the shoulders and the head could move, really nice. And maybe the arms, and they could come away from the body. Right, and the tongue, yeah, and even the tongue in the mouth could move, and the lips could move, yeah. And see if we can kind of bring movement where it feels frozen. And I want you to take your time with this. I'm not just proving that you can move, but give yourself the gift of movement if it feels safe to do so. And if it doesn't, you certainly let me know and we can do something. And as you begin to move or allow movement, right? And you could do anything you want. You could be in the chair, you can get out of the chair, you can leave the screen. You're quite free in this moment and not required to do anything. Just notice what, if anything, happens with that frozen feeling.
Yeah.
What do you notice?
Well, I mean, if I move, then I'm not frozen anymore. So I could dance, I could do whatever I want.
Yeah. So can you just say that again? That was quite profound what you just said. If I
move, then I could do whatever I want. Like I can dance. I could, so.
Yeah. And so if you like, you can kind of come back here. So we don't want to leave her there too much. I just want to, even as you say that, Jennifer, I'm actually quite sort of moved. Can I share just a little bit about why I think that is?
Yeah, sure.
As you were talking about it, yeah, there is this sense of I have to do something, and it may be I have to do something because I committed to it on someone else's behalf, or I have to do something because I'm the kind of person who does things, or whatever those things might be for you. And if we had some more time or we continued coaching together, I might learn, what some of those things are. But, I kind of recognize the idea, this possibility that, if you can move, it means you're not frozen. You can do anything were the words that you used. And it was moving to me, I think, in part because that seems to be true. And again, this is dicey and it can be difficult to work with a mind that says otherwise, but it seems to be quite profound, that you're in this place of you can make these choices, and that's a really nice thing to have access to when you're noticing this frozen feeling, which sort of comes up. So I want to ask too, is if that feels familiar in some way, like when you do get into these situations and you're wanting to just check out or distract or do TikTok or whatever it is, if that feels a little bit like what is going on, that you're wanting to not be with because it's super uncomfortable to be frozen, does that feel true to your experience?
Oh yeah, absolutely.
Yeah. So it's just a small piece of work that we're doing today. But I want to ask, sort of in the spirit of coaching too, is just in the conversation that we have just had, is there anything in this that you feel like you could take and would be helpful for you, that version of you that opens the email and this experience internally starts to unfold? Is there anything in what we've done today that could be supportive of her?
Oh my God, yeah, that was a big help. I mean, it's a big paradigm shift, because I'm able to because it's times when I do get paralyzed on occasion.
Yeah.
And instead of just staying there or feeling like I'm stuck there, then I could just dance. Like, in my mind, I could dance in my mind, and dancing seems silly, like it seems stupid or silly in the moment, but why not?
Yeah.
So
Yeah.
no, that's very profound. I appreciate that.
I love it. I think about sort of this term wise mind, and I feel like as we're talking about this right now, you're speaking from that kind of wise place of being able to see and knowing that you have a mind that might accuse you of silliness later, and making kind of a strong declaration. Let it be silly, okay, because it serves this function, and it really sort of speaks to this value, I think, of you're taking care of yourself even when you distract. I mean, it's beautiful what we do. And through part of the conversation here, seeing like, oh, I do care about taking care of myself. I care about being free. I care about being in choice, whatever it might be, and that there might be other options for taking care of ourselves, like noticing frozen, and just being able to sort of give ourselves the gift of movement in that case. So I'd be really curious to see how that works.
Yeah, that's so helpful. Thank you so much.
Well, thank you for the gift of your story and your willingness to kind of be in this with me. I really appreciate it and feel a bit wiser myself for having spoken together.
Yeah, I appreciate it. So hopefully you enjoyed that presentation, and hopefully you can see some of the pieces of acceptance and commitment therapy that are part of it. So just to wrap up, there are some ACT coaching resources that you could take advantage of. So remember, as I said, that ACT is a non-proprietary and kind of open source therapy, and so it could be used by anyone. And one of the best ways to do that is to join the Association for Contextual Behavioral Science. You can go there at www.contextualpsychology.org and join. You don't have to be a therapist to join. You can join. Anybody can join. Also, there's a number of resources and books that are available in regards to ACT. So there's a book called Maximize Your Coaching Effectiveness with Acceptance and Commitment Therapy by Dr. Richard Blana. And then there's another book called Acceptance and Commitment Coaching, Distinctive Features by John Hill and Joe Oliver. And then just, for Christians, there is an Act for Clergy and Pastoral Counselors book. That book is good. I have that book at home. It's very helpful. And then Acceptance and Commitment Therapy for Christian Clients. So if you're interested in those books, you could either get them from New Harbinger Publications or from Routledge. And so I really appreciate your time. I appreciate being able to talk to you about this topic. And so thank you so much.